So our first presentation, as we say, for the last 6-7 years, she's been helping aging, maturing veterans around the country get information they need to know. They might not want to know, but they need to know. So it's Dr. Molly McGoy, geriatrician, and she will do a caregiver's overview. Dr. McGoy.
Good morning, everyone. So thank you for coming out. This is an early morning presentation, and it was a lot of fog out there, so I appreciate you all coming out. It is my pleasure to be here to kind of talk to you about the different things to consider for caregiving. How many people here are caregivers or expecting to become caregivers? Yeah, a lot. Yeah. Did you know that in the past 10 years, AARP recently published a study, in the past 10 years, the amount of caregivers has increased by 45%. Okay, so that's 1 in 4 adults in America. That's 63 million caregivers. That's a lot. That's a lot. And a lot of them are not being paid. And we do a lot of care for our loved ones, and people don't always understand. Today, VVA and the VA are interested in providing you a set of tools and to help you to be able to care for your loved one. Sometimes the veteran is the caregiver, and sometimes the veteran is being cared for by their loved one. So there's a lot of different roles here, and we want to give you the tools to be able to address the different and shifting needs. So today we're going to talk about the concepts of caregiving. We're going to talk a little bit about some sort of supportive services, and we're also going to talk about planning for the future. So on that first slide, there was a picture of a roller coaster. When I'm seeing patients in the clinic, I talk to them that you're on this roller coaster of a ride right now as a caregiver or as a person with a new chronic disease. You're being pushed right, left, up, down. You sometimes don't know which direction you're in. And so what I wanted to do is develop a set of tools, such as an acronym with that roller coaster going up and down, to help to bring to any chronic disease. So today we're going to talk a little bit about Parkinson's disease, dementia, and a little bit about PTSD. And so the acronym, I'm just going to go ahead and put it out there, is understand the disease, prioritize your environment, delegate or ask for help, observe and let go, well-being and self-care, and name and recognize the different stages of grief. And we're going to talk why this is important. So many times in the clinic, I hear from the caregivers about what they're experiencing. So I've brought some of those caregivers here so that you can listen to a perspective from a caregiver. So here's our first caregiver.
I don't understand what is happening with my wife. She seems more confused and withdrawn.
Can you hear that?
She used to know how to drive to our favorite restaurants. Now is turning to me to help with directions, people's names, and seems to forget our plans for the next day.
Did everybody hear that? Okay. Okay, good. All right, so for the acronym UP, understand the disease. What is dementia? Dementia changes the way the brain thinks, simply put. There's lots of different types of dementia. The most common is Alzheimer's dementia. But a person loses the ability to have logical thought, the ability to make rational decisions, and also the lack of emotional control sometimes. So what's really important when you're learning to be a caretaker for somebody with dementia is that it's not that somebody's trying to do this on purpose. The brain has a disease, and it's not able to think it's the normal way that it normally thinks, okay? So to help with that, learning the different stages of Alzheimer's dementia in particular, there are 7 stages, okay? The first stage is a normal cognitive functioning. But as in this case, the gentleman who presented first, he was starting to not understand what was going on. His wife was not able to understand certain things anymore, and she didn't seem to understand where she could drive anymore. So you can see where she starts pacing through these different stages. Second stage, you lose familiar objects and names. Now, a lot of people ask, what's the difference between this and normal cognitive decline as you age? It's how often it's happening and how frequently that you're experiencing some of these episodes. When you start getting lost with driving, then you're more into the third stage of Alzheimer's. And then when you start withdrawing socially, that's the fourth stage. One of the things that you also look for is to see whether or not people are losing weight, because around the fourth stage, people stop learning how to cook or being able to cook, and they start losing weight. So that's often a trigger sign in geriatrics that we need to look for something a little bit more closely. Stage 5, people may start to wander, and they forget information or events. And stage 6, they start requiring more help with ADLs. ADLs are activities of daily living, and that's like taking a shower, getting dressed, or going to the bathroom. People start needing help with these types of functions. This is getting closer and closer towards the end stages of dementia. By the 7th stage, people lose coordination, they're not able to walk, they're mostly bedbound, and their bodily functions become a little impaired. So some of the things we're going to be talking about are a little hard to talk about, but it is important to know about them so that you can help either be aware of them for the future, or you can be able to know the tool sets that you need to be able to help in the future. So let's listen to this caretaker.
I'm caring for my husband with dementia, and I don't understand why he is getting up in the middle of the night checking the doors and windows. He seems confused, and I can't get him back to bed.
So in this case, being veterans, we know that sometimes with that hypervigilance of checking the doors and the windows, whether or not that is actually PTSD, that's of a concern. So trying to differentiate, is this dementia or PTSD? So in any case, prioritizing the environment is essential, and you have to think about those safety concerns, the firearms in particular. That's the hardest thing for veterans to sometimes give up when they have dementia, because their brain, again, it's a disease of the brain, they don't understand how things work anymore, and the logical thought isn't there. So safety is important. As a caregiver, your reaction is key. You have to be able to recognize and identify these different behaviors, as she is right now, but she's also getting upset because she's not being able to get some sleep. You need to have a routine schedule. That's essential, particularly for dementia. So sometimes you can't always go on your vacation trips as what you've planned, because just changing environments can really cause a lot of discomfort and confusion for people. You also need to be considerate of the TV choices that you have online. So if somebody is having problems with dementia, sometimes they're not aware of that that's the TV that's not real anymore, and they actually become absorbed in the TV as that's a reality for them. And as you know, also for military and PTSD, that can sometimes trigger some events as well. So one thing that can really help is called sleep hygiene. How many people know about sleep hygiene here? That's more than I thought. That's great. So this is one of the things that we talk about in our clinic a lot, because if you take sleep hygiene and you try to do a lot of these different interventions, it can really help with not only the veteran or the caregiver with their sleep, it can really help overall with the overall mood as well. So I've got a short video I want to show you on sleep hygiene. It's about a 3-minute video.
Did you know that poor sleep can silently sabotage your heart, memory, and mental health? It's a hidden epidemic affecting millions. Let's uncover the surprising way to improve your and your loved one's health with sleep hygiene. Sleep hygiene is more than just getting enough sleep. It's about creating relaxing habits in an environment that promotes restful sleep. It's imperative to create a nightly ritual that stimulates your 5 senses to create a conditioned response to improve your chances of restful quality sleep. A sleep-friendly environment is crucial. Let's start with the room temperature. Typically, a cooler environment from 60 to 69 degrees Fahrenheit promotes the sleep body's natural thermoregulation to facilitate falling and staying asleep. Adjustments to the temperature may be needed based on personal preferences, bedding, and clothing. Further stimulate your touch sense by using a comfortable mattress, pillows, and bedding. Keep your bedroom quiet, dark, and eliminate bright lights such as electronics and charging devices. Blue, green, and white lights can stimulate your body to awaken. Many people have used black electric tape over these small lights in their bedroom to block out these small electronic device lights at night. Use motion sensor red lights to highlight the pathway to the bathroom or door. Invest in blackout curtains or blinds that fully eliminate the light around the edges of the window. Technology can be a sleep disruptor. Avoid watching TV and/or screen time with your cell phone or computer in bed, and at least 1 hour prior to going to bed. These screens have backlit blue lights that stimulate you to stay awake. Additionally, if you have PTSD, avoiding any visual images such as TV movies or sounds related to your triggers of PTSD is essential in creating a relaxing environment. Trigger your hearing sense by either using a noise machine or earplugs to block out any sound. Use only sounds that provide comfort and calming effects. Establish a pre-sleep routine the hour prior to going to sleep. Consider a relaxing bedtime routine such as meditation, taking a warm shower, light stretching, or reading with a dim light. Prior to getting into bed, consider a taste that you can associate with sleep, such as chamomile tea or warm milk. Additionally, use a smell such as lavender hand lotion or spray on your pillow immediately prior to lying down. If you require a medication to help sleep due to PTSD, hallucinations, or insomnia, take your medication 30 minutes consistently prior to bed at the same time each night. As you establish this sleep hygiene routine, this conditioned response, you may be able to decrease your medications over time with your physician's supervision. Maintain a consistent sleep schedule. Go to bed and wake up at the same time every day, even on weekends. If you can't sleep after 20 minutes, get up and do a calming activity until you feel sleepy again. During the day, habits such as regular exercise, but not too close to bedtime, limiting daytime naps to 1 hour, and early morning exposure to natural daylight will also assist your success for improved sleep. This early morning daylight helps with your natural circadian rhythm cycle. It is also important to avoid caffeine, nicotine, and alcohol for several hours before bedtime. Start your or your loved one's journey by prioritizing sleep hygiene by stimulating the 5 senses with a nighttime ritual. These steps can boost your energy, mood, memory, and health. The more you use the sleep hygiene routine, the stronger the response will become, which can help with PTSD and lowering medication use. Remember that individual needs may vary, so it's important to find the combination of habits that works best for you or your loved one.
So I can definitely say when I use that little black electrical tape over my little lights for my chargers or my TV screen or any of that, it made all the difference. So just taking one of those things, those recommendations, or when you stack them all together can really make a huge difference on your ability to learn how to sleep better. So next we're going to hear from a caregiver, and I'm going to warn you, it talks about urinary incontinence. So some people get a little uncomfortable about this, but this is one of the things that we deal with in the geriatric clinic all the time.
My husband no longer recognizes our children when they visit, and he is driving me crazy with urinating in the sink or even the laundry basket. I can't keep doing this much longer, and I'm seriously considering placement in a nursing home, even though I had promised him that I would never place him in a facility.
And we see this often. Urinary incontinence is actually one of the #1 reasons why people get institutionalized or placed into nursing homes, because people don't know how to deal with it. So the first step on the roller coaster of caregiving is the down, and the D stands for delegate, ask for help. It is essential, and I'm going to say this several times today, to get respite. Go ahead and schedule it ahead of time. Even if you think that you've got it all controlled, schedule it ahead of time. Talk to your family. Take some of their offers for help. How can we help you? It could be just taking your loved one out for a walk, a 30-minute walk, just so that you can sit there and have a cup of coffee. Also use your community resources. Respite is becoming more and more prominent in our community, and neighbors sometimes are helping out as well. And getting caregiving training, we're going to talk about that as well. So observing the behaviors, such as in this case, the urinary incontinence, is the next step to understand. The biggest thing you can do is start a toileting schedule. And that means helping your loved one go to the bathroom every 2 hours on the dot, every 2 hours. And then over the couple of days, you increase it by 15-minute increments. And what happens is you're retraining that person to use their bladder control. In this case in particular, the random urination in different areas, One of the techniques that we use and we recommend is you sew the top and the pants together. So you sew with a sewing machine, sew the top and make a zipper on the back, and you make it so they can't use their zipper in the front. So then you're getting a visual clue that they need to go to the bathroom because they're trying to undo their pants. And it's like an adult onesie, basically. So it gives you the clue that they need to go to the bathroom, and that stops some of the behavior. Also, using briefs and liners. Many times in my clinic, I would say to the people, they're using briefs, but they have to take the briefs off every time there's urinary incontinence. So if you use a liner in the brief, you just remove the liner, and the briefs are still there, and you don't have to take all their clothes off and change all of their clothes. So there's little tricks that you can learn from a caregiver training that's really important. The other part of observe and let go is observing the behaviors in dementia. How do you deal with that? So understanding the disease, it's a matter of how the brain is no longer working the same way. Okay, so they are taking clues from you, the caregiver, on how to respond. So if you're happy, they're going to be happy. If you're angry or frustrated or upset, they're going to be angry, frustrated, and upset. So you have to become a little bit of an actor or an actress, even when things are going bad. Like you might have a flat tire. Well, this is an excuse to have a picnic by the side of the road, hon. Let's do this. You know, it's like they're going to take your reaction and mirror it. Give 1 to 2 choices. So do you want the red shirt or do you want the blue shirt? Okay, give people choices. People with the disease of the brain still have trouble making big choice decisions, but they want to be included and they want to have meaning and they want to have some control. They're losing control because they know their brain is not functioning right. Same thing with food preferences or activities. Even taking a shower. You might be having difficulty getting your loved one to take a shower. Do you want to sit down for the shower on the shower chair, or do you want to stand up for the shower? Giving choices so that they feel more in control. And then future discussions and planning. So you're used to talking to your loved one about that upcoming doctor's appointment. Okay, next week we're going to go see the doctor. What happens is that sometimes people feel out of control, and so they start arguing. No, I don't want to go see the doctor. Okay, so you don't discuss. You just say on the day of the doctor's office, you say, we've got a couple of errands to run. Let's go, and one of the errands we're going to do is we're going to stop and see the doctors. I've got to go see the doctor. Okay, focus on giving meaningful tasks so that they have purpose as well. So one caregiver who was taking care of her father with dementia had a bag of leaves on her deck. And whenever the father was getting antsy and wanted something to do, she would spread the bag of leaves out on the deck and ask her father to sweep them up and put them in the bag. He felt like he was doing something to help. Okay? It's really important to have meaning in the tasks that you ask help for. And questions. Many times people, as their dementia gets worse, they might say, you know, is my mother dead? Well, yes, you focus on keeping the truth and then giving reassurance. But you know, your mother loved you so very much. What do you remember most about your mother? And so you change and you do reassurance, and you also keep the answers very short. So letting go, that's the hardest thing sometimes, okay? Letting go of your expectations. You and your loved one were probably expecting to travel the world and have a whole bunch of wonderful excursions. But now that has changed, okay? You got to let go of those expectations and say, listen, my life is going to change now. And what I expect will only set me up for more frustration and failure. Your time. It might take your loved one 2 hours to get dressed. It used to take them 10 minutes. But that's okay. They are getting dressed in their own time and their own space. And that difference in time and letting go of that time expectation will help you decrease your frustrations. And what your life used to be. I was a caretaker for my mother for her terminal disease. And for those last 2 years of life, we changed because she could hardly speak for those last 2 years of her life. And so we would sit out on the porch and just hold hands, looking out on the porch. That's letting go of what your life used to be, okay? And you're letting go of the future. Your future is going to change, and it's accepting that in that moment what your life is going to be like. So now talking about well-being and self-care, scheduling time for yourself is important. Here's a caretaker.
Every morning, I get up 1 hour prior to my partner who has dementia, which is sometimes 5 a.m. I use this time as my time, which is when I do yoga and have a cup of coffee looking at the skyline. This has been a really important part of my daily self-care.
So again, respite is essential every day, and also a prolonged respite, either that can be for a week in the community, but scheduling respite is really important. So in this case, this caretaker is getting up an hour early, even though he probably wishes he could sleep in, just to be able to have that time to himself. Next, we're going to talk about the N of the up and down of the roller coaster. Name and recognize the stages of grief. How many people are familiar with stages of grief? A lot, okay? It's not just for the death of somebody or somebody that you're going through. It's actually now it's the death of basically your life and what it used to be. But everybody in your family is going through the same thing. Everybody's going through their different stages. So you're gonna have denial. You're gonna have hope sometimes. Sometimes it's gonna be mixed in with bargaining and anger and depression and acceptance. And it's just a circle. Sometimes you've already hit the denial maybe stage 2 or 3 times, but you can come back to it. Everybody's at a different stage. So let's take a look at the first gentleman. He was upset because his wife was not remembering about what they were going to do the next day. What do you think he's in? What stage do you think he's in? Yep, denial, okay? Because he was like, she can't do what she used to do. Why is that? I can't believe this. This woman who was angry because she couldn't sleep at night because her husband was up wandering around and checking the doors. Anger, yeah. She was trying to figure out why was she angry. Some depression too. This woman with the urinary incontinence issue that she was saying, listen, I promised him I wouldn't put him in the nursing home. You know, I promised him, but you know, I can't deal with this anymore. Some guilt, yeah. And some bargaining too. If he would only stop urinating everywhere, I wouldn't have to put him into the nursing home. And this gentleman who was doing the self-care and being able to take that time. Acceptance, yep. So I want to do this for Parkinson's disease too, because that's another big disease process, chronic disease process, particularly for Vietnam veterans from the Agent Orange exposure. So here's a caretaker who has a family member who is recently diagnosed with Parkinson's.
My mother has been living with us for the past few years. She has been falling more and seems more clumsy with holding things. Her tremor is much worse, and the doctor just diagnosed her with Parkinson's disease. What do I need to know about this diagnosis?
So taking this acronym up, understand the disease. Parkinson's disease is actually a decrease in the dopamine levels. And dopamine is that feel-good medicine or neurotransmitter inside of us, but it is also used for movement. Okay, so it's the same thing that we use to be able to talk, to get our motor neurons working for talking, for driving, for moving around. Okay, so I have this one close friend of the family who has Parkinson's. And I noticed that he kept getting really upset and anxious every time we would go out to have our lunch. Once a month we go out and have lunch together. And I was driving the speed limit, didn't understand it. And he said, listen, he says, when you're driving, he says, I can't see everything that's coming around these curves as well. He had slower processing of the input for the information coming in. So he was getting anxious because I was driving the speed limit. When I dropped down to 10 miles under the speed limit, he no longer was getting anxious when I was driving. Prioritize your environment. So this woman, she's trying to figure out what do I need to do for my home to make it better for my loved one. 1, slow down. One little trick to use is when somebody has Parkinson's, you mirror how fast they are talking. So you can see that I am slowing down and how fast I talk. Take clues on how fast that person is talking to how fast they need to be able to process information. Address preventable falls. There are preventable falls and non-preventable falls. Everybody falls. Okay, that is a common misnomer, so to speak, that people think that you will never fall. Everybody's going to fall. It's preventing the falls that are easily preventable, such as for a person with Parkinson's, picking up the rugs off the floor. Have just a smooth surface. Okay, don't have any more throw rugs. Putting little bumpers on sharp corners of your furniture. That can help when you eventually have a fall. And using the walkers or the canes or the assistive devices. That's helping prevent a fall. Economize the movements and distances. So your loved one might be living in the guest bedroom, but there's another room that's closer to the bathroom or closer to the kitchen. Changing rooms so that they don't have to walk as far. And for Parkinson's in particular, doing scheduled medications. So having their medications within an hour of when they're supposed to have their medications helps prevent them from freezing up. So using your phone alarm or using your wristwatch alarm, taking those medicines on a routine basis can really help with caregiving with Parkinson's. Here's another caregiver.
My dad is becoming resistant to taking showers because I believe he's afraid of falling and doesn't want me to help with the showers. I'm noticing that he is having more accidents in the bathroom and he's needing help to keep clean. What do I do when he's so resistant to my help?
So I get this a lot. You want to ask first and have an open communication with your loved one. Ask the father, listen, is it because I'm your daughter and you don't want me to wash in the private areas? Or is it because you just feel so anxious in the shower now? You're feeling very anxious. Is it because you're worried that you might be a burden? Trying to figure out the reason why to help address the issue. But also ask for help to get help in the home. Sometimes you can get a homemaker home health aide or a CNA to come in and help take a shower. If it's the male-female issue, you can request a male CNA to help give the showers on that shower day. Get an occupational therapy assessment. Look around the house for anything that might be, for fall risk, but also in the bathroom, could some handles in the bathroom help prevent the anxiety that's associated with taking a shower? And training in ways to care. There is this great education called Bathing Without a Battle, in particular for people who are resistant to taking showers. And that's the type of education we use in the nursing homes. Here's another caregiver.
My father has Parkinson's disease and is living with us. He seems more withdrawn, and I'm having trouble engaging him in conversations. How can I help him feel a part of our family again?
So understand the disease, that up part again, okay? The dopamine. It's not transmitting as quickly anymore because you don't have as much of it. Okay, so could this be that he's not partaking in the conversation because he can't understand the rapid conversation that's going on? Or could it be that he has trouble with his hearing and his sensory input, and he needs hearing aids or he doesn't have his hearing aids in? The other issue also with this is many people with Parkinson's disease, because it's a lowering of the dopamine, is that you're going to have depression. And mood changes is very, very common with people with Parkinson's because you don't have that normal amount of dopamine anymore. You need to educate the family on the kids as well, that they need to know how to take care of their grandfather that's in the house now and to include him in the conversations. Here's another caregiver for well-being and self-care, and this is another perspective we get quite often.
At first, I didn't want anyone to know we were struggling with my husband's Parkinson's disease. A couple from our VVA community reached out and told me how important it was to use the available respite services homemaker health aid, and adaptive equipment available to veterans. I had no idea how much was available. Taking time out every day for me to exercise or meet with my support group or go to my own medical appointments has enabled me to not feel the resentment and burnout that so many other caregivers go through.
So again, taking care of yourself is essential so you don't become the patient yourself, because who's going to take care of your loved one when you're not able to? Doing the daily and the scheduled routine respites, that's very important. And unfortunately, once you get burnout, it's really hard to come back from burnout. You need a lot of assistance from that. So ask for it ahead of time, even if you think that you can do it all on your own. So we've got one more story of a caregiver, and we're going to do the name and recognize the stage of grief. So listen to this gentleman's story of what he's dealing with in his family.
I feel stuck in the middle. My sister thinks that if we changed my father's diet, the Parkinson's would get better. My wife is angry because she is trying to provide healthy meals, but nothing seems to be good enough for my sister. My kids are kids. They move so fast and leave things on the floor, which my dad could trip over. And Dad is sleeping all the time. I feel if we could just get the medications right, Dad could be happy again, and we'd go back to the way it used to be.
So naming each of the stages, this helps actually decrease the drama in the family. So this is a tool to use when you're trying the best you can as a caregiver and you're stressed out, but everybody else seems to be putting their problems on you as well, okay? Is naming where their loved one and also the other family members are in the different stages of the disease, of the grief. So the sister, she thinks that the dinners should be a certain type, and if it was only this type, what would be acceptable for the Parkinson's would go away. What do you think she is? What type of? Yep, denial. The wife, who is angry at the sister. I just gave away the clue. Anger. Sorry about that. The kids, they're playing, they're leaving things on the floor. They don't realize what's going on with their grandpa. What do you think they're going through? Denial and maybe even acceptance. Kids are resilient, okay? They're kind of, they just accept people wherever they're at, okay? And so you can easily tell them, listen, this is what's going on, be very careful. The father, yeah, and also some depression. I have his depression too, he's withdrawn. Like we talked about before, he could be not participating because he can't hear. And the son, and who's the caregiver. Yeah, he's bargaining. Gosh, if we could just get the medications, everything would be fine. He hopes. So today is all about trying to give you the tools. So that an acronym can help with giving you the tools to address different types of chronic medical conditions. But also, we're talking about a lot of the different resources that are available here today. So the medical resources, your physician, your internist, your nurse practitioner, your PA. Your social worker is key as well. I cannot emphasize that enough because they have a pulse on all the different types of resources that are available in the VA, but also in the community. Your VA, we have a whole department dedicated just to geriatrics. We also have home-based primary care so that if you can't get to the VA, they can come to you. We also have the caregiver support programs, and Emily is going to be talking about this next to give you more details. There's three different types now of caregiver support programs. And there's the REACH program. The REACH program is actually where it's for the caregiver. So it's the only program in the VA where it's giving support to the person who may not be a veteran, because it's giving direct support to the caregiver of the veteran. And it gives you resources on how to deal with different types of behaviors. There's a whole list of great resources, and we have some of those books up front. And the NIC institutional care programs, those are like the contract adult day programs. Those are your nursing home programs, the different programs that help you stay independent at home. In the community, there's something called PACE. So some people are not enrolled in the VA. We have enrollment and eligibility out front as well as VBA, but some people are not enrolled in the VA. And so the PACE program is a Medicare-based program that gives comprehensive care to people so that if they are at a level of care that's needing nursing home level of care, and it helps enable them to stay independent as possible. The adult day programs, the home care services, we have one of our representatives outside, respite, and of course occupational therapy and physical therapists can really help you with caregiving. Out in the lobby, we have AARP, MAP, which is Mountain Aging Partners for Adult Day. Senior helpers and the State Veterans Home are all out in the lobby to answer any type of questions for the community resources for caregiving as well. What is fascinating about what's happening in the community as well is we have 10,000 people turning 65 every day until the year 2030. 10,000. Okay, so Medicare started up a program called the GUIDE program, and that's Medicare Guiding an Improved Dementia Experience, and it's support for the caregiver. So it gives you education. It's just like the VA REACH program, but this is for somebody who might not have that opportunity at the VA. And the other interesting thing is that communities are starting to come together. We saw that a lot with our hurricane, where our community came together to help each other out, and that was so inspiring. But what we're also seeing it is in the communities, such as in Weaverville, some of the people are coming together and they've created a Creekside Care Crew in which they're helping their community elderly out. And aging in place and Habitat for Humanity. If people are having home or insecurities about where to live as they get older and they can't afford some of the other options, this is another option. So we have some of the books out on the table out front. We have also online resources, Teepa Snow, videos for dementia. She is a nurse who does some great videos on how to care for people and different dementia behaviors that they're having. There's the VA, and there's community resources. And valiantage.org is one of the videos that you saw. The books that we're talking about, Learning to Speak Alzheimer's, great book. Each one of these is wonderful. The 36-Hour Day, Reach VA resource books, Creating Moments of Joy. That's changing that perspective and letting go. And the Memory Caregivers collection actually is written by a local person here in Asheville who works with memory care, and she wrote up a whole bunch of little things to help with dealing with different situations and being a caregiver. And I have a copy of the book out front if you want to take a look at that, and it's a very good book. So planning for the future. It's really essential to think about the future, as hard as it is sometimes, to embrace some of the things that you're going through with your changing body. So one of the things that we talk about is the final gift. And that's making sure that you document what your wishes are for end of life, whether you are the person with the medical issue or the caregiver helping your loved one with this documentation. In the community, there's something called the MOST form. And in the VA, it's called an LSTI, Life Sustaining Treatment Initiative form. Okay? And what it does is it becomes a doctor's order of what you wish to have happen if you're not able to talk yourself on what you desire for your end of life. So whether or not you want to have attempted resuscitation or whether or not you want to allow a natural death. In the VA, the LSTI follows you to every VA. So once you get it signed and put in your chart, it follows you wherever you go. And you want to have those goals of conversations with either your medical team, your social worker, and fill out your healthcare power of attorney. One thing that I recently added to the list that's really important is also a hospital to go bag. My father was just hospitalized 2 weeks ago, and fortunately I had some of this information, not all in a bag, and I will be putting it in a bag, but it's a list of his medications, okay? Your most up-to-date list. Your CPAP settings, okay? Your copy of your insurance cards, list of your surgeries and your allergies. I just handed this over to the admitting people, and they were like, thank you so much. He was admitted so much faster through the whole process. So, in summary, we're talking about the ups and the downs on the roller coaster feeling that you have as a caregiver taking care of somebody with a chronic disease. Understand the disease is really important, because if you understand the disease, you can understand their perspective and where they're coming from. Prioritize your environment. Get the adaptive equipment in hand. Help with all the different things that you can do to modify your environment to make it easier for you and your loved one. Delegate and ask for help. You need to do that. You can't do it all on your own. Observe and let go the behaviors, and also letting go of what your past used to be. Enjoy the moment, because sometimes there are these little glimpses, these little gifts of a special moment with your loved one if you're able to let go of all the expectations. Okay? I hear some confirmation there. Thank you. And then do well-being and self-care. Again, the respite. Scheduled respite daily for yourself, even if it's a 15-minute cup of coffee, okay? Or you have to get up early to do it. And then also in the future, like a few days of respite where you're not caring for anybody but yourself. Name and recognize the stage of grief. That helps decrease the trauma and the games that get played with family members thinking that they know everything as you're trying to do the best you can. Find local supportive services. If you're not getting the answers from the people that you think you should be getting them from, be persistent. You are your advocate for your loved one. Keep asking questions. There's a lot of resources out there that I had no idea after I left the VA. And complete legal documentation. It is essential to have all that information available, because if you have that information available, it's a gift that you're giving your loved ones, so that they know that, you know that they know that it's going to be okay if the decision is to let go. So I want to thank Alan Percall, the family of VVA. You guys have always welcomed me with open arms, and I really appreciate you guys. Director Young, and now Ms. Weber as the acting director, thank you very much for Western North Carolina VA healthcare system. Anybody would have any questions?
Thank you. You spoke about dementia and Parkinson's being both brain-centered.
Mm-hmm.
You didn't speak about Alzheimer's. Does dementia automatically lead to Alzheimer's, or do we have a different illness of the brain?
So dementia is kind of like Alzheimer's is a subset of dementia. Okay, so it can lead right up into that. Now, the main thing is Alzheimer's is one of the most common types of dementia. Okay, but there's many types of mixed dementia. Okay, and that can be Alzheimer's, it can be vascular dementia. So the different subsets can combine and become part of dementia as a whole.
Okay, so with Alzheimer's, which I've always assumed is much worse than dementia, are there any specific signs for this? Thank you very much.
One sign that I often talk to people about is misplacing things in the house, okay, where you might become a little bit more concerned. Like all of a sudden you see the milk carton in the dishwasher. Huh, okay. But if that happens over and over again, like you see your keys in the fridge, okay, those are the types of things. That means you're not connecting where things normally go, okay? That can be more concerning. Getting lost in places that you normally would never get lost while driving, okay? That's more concerning too. The VA has a clinic that can do a complete evaluation. Actually, there's two different ways. One, you can do it through a mental health clinic, and one, you can do it through the geriatric clinic. And they do extensive testing to determine what type of dementia you're dealing with, because different dementias have different treatments. Anything else? Questions? Stevie.
Will we be able to have access to a video of your wonderful presentation?
That's what we're working on. That's why we have these two gentlemen in the back taking pictures and videotaping, and we'll try to make that available. Yes, ma'am. Mm-hmm. Any other questions? Yes, sir.
How can you keep giving after you die by giving your body to science?
How can you keep giving after you die to give your body to science? You can contact medical schools. Medical schools are where most of the body donations can go to, and you get a card so that you put in your wallet or you let your family know that as well. That's where in medical school we get the ability to do the anatomy, and that's an incredible gift to give. Part of giving your body to science also, if you have a certain medical condition that they might be more interested in, like Duke has a program where you can donate your brain, in particular interested in Parkinson's disease, you can donate your brain there for further study specifically for different areas. You're welcome. Any other questions?